We saw her for 8 visits. Some people have had multiple surgeries, and they come in and they're like, wow, I can't believe I can get in there and feel so much better.
Oh, that's just so comforting amazing. For them and for you. Just even watching you talk about it, you kind of light up knowing that you're really helping someone.
Well, it feels really good to make a difference and help people feel better. That's why we do what we do.
Before we end real quick, how can a patient find out more about rehab services in general at Tomah Health?
So if they go to tomahhealth.org, our website, they can get more information, and that's probably the best way to do that right now. But they also can talk to their medical provider and ask for referral to our rehab services department.
Kris, thank you, and thank you for your work.
Yeah, thank you.
It's exciting.
Thank you.
Well, up next we have Charlene from Juneau County Aging and Disability Resource Center to talk about an exciting new grant for our community. See you in 2.
My name is Heidi Stalsberg. I'm the director of Tomah Health, Hospice Touch, Life Choices Palliative Care. We have hospice home care, we have palliative care, which is a home care service, and then we have Serenity House, which is our 8-bed residential facility here in Tomah.
Hospice Touch and Life Choices Palliative Care provides medical services, emotional support, and spiritual resources.
Tomah Health, Hospice and Palliative Care, inspiring health, wellness, and balance.
The Oakdale Credit Union has spent decades serving Oakdale, Mauston, and Reedsburg. From comprehensive financial services to reliable mortgage loans, we strive to provide unparalleled care.
I like the warm and friendly atmosphere each and every time I come in. The staff is very knowledgeable and truly cares about its members.
Come and learn more about the Oakdale Credit Union, where we treat you like a member of the family.
You want it, we'll find it, you got it. Price match and relax. That's the Rudick Jensen deal, sealed with a platinum level membership. Oil changes, done. Tires, brakes, alignment, all done. Car wash, you got it. Rudick Jensen Auto Mall, New Lisbon. Check out our inventory online at rudickjensen.com.
Relax at Marco's Italian and American Grill in Warrens, Wisconsin.
Hi, I'm Josh Tully from The Josh Tully Show. You're watching Lynxx 24, connecting you to the community.
The Innovative Coordinated Access and Mobility Grant is allowing Adams and Juneau counties to hire a full-time mobility manager to coordinate transportation within and between the 2 counties. We have Charlene Norberg here to tell us what that means for you and for Juneau County. Welcome back, Charlene. It's great to have you.
Yes, thank you.
Welcome, Charlene.
Thank you.
And you got a grant, and a grant's free money, right?
It is free money.
How long have you been working on that?
Oh, so we submitted the grant in November of 2018, and we got word that we were approved in May of 2019.
Did you write the grant?
Oh, goodness, no.
Oh, really? Okay. Well,
we hired a grant writer.
Oh, okay, good.
Not a grant writer.
Okay.
But yeah, no. So when I say we, it is actually a collaboration between more than just Juneau and Adams County. Oh. We coordinated with Southwest Wisconsin Community Action Program. They cover 5 counties for the grant, and then I had wanted to write in for this grant, and I found out that they were also interested in writing in for it, and because it's a coordinated access and mobility, we said, hey, let's come together and write this together. So that's what we did. And so their piece is creating software for volunteer driver programs, dispatching, transportation, which is perfect because then we'll come into that side of it toward the end of the grant. But our Juneau and Adams County, how we're starting on our side of it is with this mobility manager. So it's actually kind of 7 counties together, which is really, really coordinated.
So what is the grant all about then?
Yes. So I am so excited about this grant. This grant is aimed at healthcare, at helping people to access healthcare.
Okay.
And Juneau and Adams County have such a difficult time with that. We know that we need to get access to healthcare. Adams County has Mountain View Hospital. We have Mile Bluff and Gunderson. But the problem is that you see a lot of people who end up with very costly inpatient hospital admissions. And hospitals have these, through Medicare and through other plans, you're supposed to try to not have re-hospitalizations for the same medical condition within a certain time period. And we've found that when somebody gets to their first follow-up appointment after a hospital admission and subsequent appointments after that, or when they are able to get to preventive visits, that their risk of being hospitalized goes down. So we were thinking, how can we get transportation out? We have transportation options, and we can utilize those transportation options, but
cabs and things like that?
Yeah.
Okay, right.
But how can we coordinate that? Because the issue is that it's not just getting Juneau County to Mile Bluff or Adams County to Mountain View. There's a lot of cross-county, people live right on the county lines. Some people might live right over into Monroe County. Some people might live right over into Vernon County. And so it's a bigger issue than just getting our local people to the hospital. How can we address that?
Your real rural residents, getting them into these medical centers.
Exactly.
Okay.
And across the state, there's this mobility manager model, and there's already grants out there to support that. There's federal grants. But this would allow us to, instead of writing in for an established grant for this position, this allows us to create the position for our area and really tailor it to the needs that we have to build it and then be able to continue it through these existing grant.
So you got to hire a manager.
Yes.
And what are they going to manage?
They're actually going to be managing, coordinating cross-county transportation. They're going to be helping us to make sure that our fleet is being utilized to the best of its capability, that we're building our volunteer driver system, that we're coordinating between cross-county lines. We have the Family Health La Clinica Rocha Cree in Friendship.
Yes, okay, sure.
Which is a really nice alcohol and drug abuse clinic. And so that's one thing that we're thinking, how can we get a lot of people to this clinic? We finally have this great clinic. How can we get people there? This is one way
and
we can coordinate
has been a barrier for some people to
it
get
is.
the services they need.
It is such a barrier.
And this is all being done out of the Juneau County Aging and your group?
Kind of. Well, so Adams and Juneau, the ADRC director of Adams County, Donna Richards, and I are this coordinated team. We've done everything together, and it's a lot of collaborations with Southwest Cap. So we've had tons of meetings to get this going. Southwest Cap is actually the employer of the position, which allows for a lot of creativity because they get grants that we can't get. So after this grant ends, the position will be able to continue through a lot of different grants that they already have.
Are they going to be managing or coordinating with any of the actual providers, the healthcare providers?
Yes, that's actually a great question. So we have, because it's a federal grant, we actually have performance measures that we have to meet. And some of those performance measures come from the hospitals because that's data that we can't get is regarding missed appointments and different types of health programming, especially like nutrition programming.
And then there's the weather.
Chronic disease,
And then there's the weather factor. Yeah. I can see why you're so excited about this.
So the hospitals actually got on board before, as we were writing in for the grant, and they gave us their support and their recommendation, which was really great because the neat thing about this grant is that we're the only Wisconsin recipients of this grant.
Of this federal grant?
Yes.
Oh,
yes.
Wow, congratulations for sure.
Which is great for us because the federal database for like the reporting and everything that we have to do is really difficult and almost takes a new position just in that of itself. So the state of Wisconsin, who handles our state transportation grants, actually is doing all of our federal reporting.
All the admin.
So the state is in on it with us.
Great. Well, congratulations.
It is awesome.
Thank you
We're
so much for joining us.
Very good. We'll have to go out
Way to go.
We'll have to go out and do a road trip.
Yes. So just, people will just keep calling into your ADRCs and requesting transportation, and the hospitals are going to be helping coordinate those rides, and we are just going to see health go up.
Glad to share that with us.
Thank you. Nick's Moments in History is next. Stay tuned.
The Oakdale Credit Union has spent decades serving Oakdale, Mauston, and Reedsburg. From comprehensive financial services to reliable mortgage loans, we strive to provide unparalleled care.
I like the warm and friendly atmosphere each and every time I come in. The staff is very knowledgeable and truly cares about its members.
Come and learn more about the Oakdale Credit Union, where we treat you like a member of the family.
My name is Heidi Stalsberg. I'm the director of Tomah Health, Hospice Touch, Life Choices Palliative Care. We have hospice home care. We have palliative care, which is a home care service. And then we have Serenity House, which is our 8-bed residential facility here in Tomah.
Hospice Touch and Life Choices Palliative Care provides medical services, emotional support, and spiritual resources.
Tomah Health, Hospice and Palliative Care, inspiring health, wellness, and balance.
Promise me we do this together.
I promise.
Every day it's a little harder as I feel my power grow. Don't you know there's part of me that longs to go into the unknown. I believe in you, Elsa. Into the unknown. More than anyone or anything.
Disney's Frozen 2, rated PG, now available on demand.
Relax at Marco's Italian and American Grill in Warrens, Wisconsin.
You're watching Lynxx 24, connecting you to the community.
Well, April, here we are again for Moments in History.
Moments in History, Nick.
This day, February 27th. Now let's start with a couple of quick ones. Okay, the artificial sweetener saccharin was discovered by a Russian chemist, of all things, Konstantin Fahlberg, in 1879. Saccharin is better known these days as sweet and low or sugar twin. This was the gateway to other sweeteners, as I'm sure many of the viewers will know, including yourself. But saccharin early on, they had like no-cal pop back in the 60s. They had saccharin.
Tab.
Yeah, there you go, Tab.
See?
I couldn't remember that. Okay,
Tab.
very good. Well, and here's two more coming up on politics and government. Now, while all the young men were gone fighting World War I, the women folk were busy getting the 19th Amendment sent to the states for ratification. As you know, that was the vote thing. The product of 7 decades of meetings, petitions, and protests by women suffragists, the amendment took effect in August of 1920. Women could vote. Ta-da! But wait a minute. Maryland had not ratified the amendment, and when 2 women attempted to vote the following fall, they were denied the vote. A lawsuit emerged and went to the Supreme Court because there was a lot of discussion about whether this amendment was really legal. So this day, in 1922, the Supreme Court, upheld the 19th Amendment, so it had been tested in the courts for all women in the nation to vote. So there you go. Big day in history.
That is a big day. Nick.
After FDR was, this is our second one now, after FDR was reelected to a 4th term during World War II, towards the end, we had enough of one guy for 8 years, or for whatever it was, 4 times. So we decided on a 2-term limit. That's where it started. So it was decided by the 22nd Amendment to the Constitution, ratified this day in 1951. Ike was the first president to come under that rule, okay, one of which is we're very happy about these days. Now, here's a fun one. The first Mardi Gras was celebrated, because we just celebrated Mardi Gras.
Did,
okay?
right? Mm-hmm.
The first one was celebrated back in 1837 in New Orleans. Okay, 1837. But New Orleans wasn't the first to start the 40 days of fasting for Lent, okay, with a big eat and drink-a-thon. Nope, it was Mobile, Alabama. Back in a century before, in 1703 about. At that time, Mobile was the capital of the Louisiana Territory under France. After we brought the territory from Napoleon back in 1803, Louisiana Purchase. Okay, that's right. We established New Orleans as the capital of Louisiana. Capital had a few back and forths between Baton Rouge, but it didn't affect the annual Mardi Gras. So by 1837, it was firmly entrenched as part of our Louisiana Purchase, which doubled the size of the U.S. under President Jefferson. That's another history story, of course. And but you know, there's actually 3 older New Orleans. They've got New Orleans. Then there was Pensacola, Florida, and Biloxi. Okay, in addition, are all older ones. And Pensacola is a very, very old deal. So very old.
Territory.
Mardi Gras. The word Mardi Gras. Yeah, and it's a very friendly family, a family-friendly Mardi Gras. I've been there.
It's a Pensacola one.
Absolutely, you can have your kids on your shoulder with nothing to worry about. You know, weird things happening and stuff like that. New Orleans is a little bit weird. That's the history stuff.
It's very eclectic, maybe, and risque, and the New Orleans.
It's out on the edge, yeah.
It's a little edgy, right?
Yeah, right.
Did you do a big dinner, big Fat Tuesday thing, Nick?
No, I don't do any of that stuff. There was a time I just take the ashes. There were a lot of people with the ashes on their
Ash
head.
Wednesday. That's right.
On the news the other day.
Well, we want to thank you for joining us this week on your Hometown News, where we are connecting you to the community.